In last class we studied calcium. Today we will see about phosphorus. Right? Now both of these elements are measured on regular basis in laboratory because they are required for normal maintenance of physiology. Fine. Phosphorus is widely available in all sorts of compounds, whatever we know. Say suppose phospholipid, ATPs, GTPs, DNTPs, for making RNA, for making nucleic acids. So we have phosphates in all sorts of compounds, high energy compounds, etc., etc. Daily requirement is easily met with whatever we eat. Is there any something rare component in the diet? No. So we get phosphate from almost everything whatever we consume. Okay. Next. The blood in the serum its concentration is around 3 to 4 milligram per deciliter. It is to be maintained within this particular range. Like calcium, it is also very narrow range. We'll see only 10% exists as bound proteins and 40% exists as free iron. So whenever we estimate phosphate in the blood, we estimate the free phosphate. We estimate the free phosphate. Next. Keep this. Now, factors regulating calcium and phosphorus. See, this is hormones. These are hormones and these are the conditions. See, hormone, this is vitamin D, this is parathormone and this is calcitonin. Effect of 125 BSCC or vitamin D or calcitriol on calcium absorption from intestine. See, these two will increase and this one will decrease. So this is very important table. You can write it down. It will be helpful for you. So both these two will help in calcium absorption, but calcitonin. Osteolysis and osteogenesis. Osteolysis means resorption of bone. Bone resorption means weakening of the bone, withdrawal of the calcium or increasing the osteoblastic activity. In order to synthesize new bone or in order to withdraw calcium from bone, the primary step is similar. That is the conversion of osteoclast to osteoblast. Because osteoblast is a dynamic state which can exchange calcium, whether required to be taken or given. Dynamic state take maintain kore osteoblast. The primary step hoche osteoblast form kora. Therefore, in osteolysis and osteogenesis, in both the cases, effect of vitamin D is increasing. Why? Because in both the cases, it has performed only one single step. What is that? Conversion of osteoclast to osteoblast. Now, the body requires the calcium to be withdrawn. So, calcium is withdrawn from the osteoblast. If the body requires calcium to be deposited, then it will deposit through osteoblasts. But primary step is to convert the dead and senile cells into younger bone cells called osteoblasts. PTH, on the other hand, it has effect on serum calcium, positive effect. That means it will increase serum calcium level. And how do we get it? It will withdraw calcium from the bone and put it in serum. How? Because the moment they will withdraw the calcium from the bone, they will also help in the excretion of phosphate. So, in absence of phosphate, the excess of calcium will appear in the plasma or serum or blood, right? effect of calcium on osteolysis is negative. But this is not so important. This is important. See, bone formation. For bone formation, calcitonin acts opposite to PTH. It acts opposite to PTH. Why? PTH increases serum calcium level and calcitonin decreases serum calcium level. There are two ways to decrease serum calcium level. One, by stopping the calcium absorption, and two, by increasing the excretion of calcium. Okay? So calcium CT will actually increase the calcium excretion. See, calcium excretion from kidney will be increased by CT. Phosphate excretion from kidney. Again, this has similar on phosphate, whereas PTH has opposite. That's why if you have excess parathyroidism, hyperparathyroidism, you have hypophosphatemia, less phosphate in blood. If you have hypoparathyroidism, you have the opposite, hyperphosphatemia. Right? Blood calcium level is easy, you know, and phosphorus level is similar to the calcium effect, except PTH, it has opposite effect. Right? So PTH will decrease or increase opposite to vitamin D in both cases of calcium as well as phosphorus. Fine. Now you have to remember few conditions. Leading to hypophosphatemia. The first one is definitely a premature baby, you know, on breastfeed. The breast milk contains less amount of phosphate, so he will receive less amount of phosphate. Next comes malnutrition. If the father is poor, the boy will not get enough food. Chronic diarrhea means losing the important minerals. Diarrhea means loss of minerals from the body, so it cannot absorb because the food is not staying in the small intestine for longer period and it is passing through the small intestine at faster rate. So you don't get enough time to get absorbed. Long-term use of antacids. This is what many of us suffer. Those who suffer from pains, knee pains, joint pains, they go on taking painkillers, and painkillers are always given along with antacids, to reduce acidity. Now, if you take excess of antacids, these antacids chemicals, they contain aluminum hydroxide. Okay, so these causes decrease when they form compound with phosphate in the diet, and they decrease the absorption of phosphate from the intestine. Hey, good morning. What a good morning bol keu. উঠে দাঁড়া। কি মুশকিল, এসি বন্ধ করে দিতে হবে পরে। Intracellular shift of phosphate. Hypophosphatemia may be seen in case of insulin therapy. Those who are taking regular insulin therapy, under regular insulin therapy, their phosphate should be monitored. Their magnesium and phosphate should be monitored regularly. Patients undergoing insulin therapy, we must monitor their magnesium and phosphate. Respiratory alkalosis. What is this mechanism behind? Can anyone tell me? Bol. Yeah. Why there is hypophosphatemia? What happens in respiratory alkalosis? In respiratory alkalosis, the counter mechanism is through kidney, renal mechanism. Renal mechanism, we counter respiratory alkalosis by excreting what? Phosphates, correct? So they withdraw phosphate from the blood, increase urinary excretion, hyperparathyroidism and Fanconi syndrome. Fanconi syndrome is related to which part of the body? Simple to born হয়নি. Fanconi syndrome which part of the body? Renal tubule. Next. Hyperphosphatemia. They might ask you like this, name the conditions in hyperphosphatemia. So one is excess vitamin D, second one is phosphate infusion, increased cell lysis. When there is a cell death, that means in chemotherapy. Then bone diseases, where bone is being resorbed. Phosphate, excess phosphate will be appearing in the blood. So name one bone, such bone disease where phosphate will be high. Any bone disease where phosphate will be high? Hello, try karo. Correct. Paget's disease, है ना? Osteomalacia, Paget's osteoporosis. Renal impairment, yeah? Unable to excrete phosphate, and hypoparathyroidism, hyposecretion of parathyroid gland. Close call. Back যা class. আবার মার, হ্যাঁ, বন্ধ কর। এখানে যা, এটা খোল, এইটা বড় করো, है ना? Calcium, phosphorus, these were macro elements. Now I have entered micro elements. I have skipped two macro elements. Can you name them? Sodium and potassium. It will be taught by someone else because that has to be taught together. Sodium, potassium and chloride. Now, copper, as you know, if you burn out the whole body, you will get 100 to 150 milligram, and RDA is very less, 2 to 3 milligram per day. Which elements we call microelements or trace elements? Which elements are we call micro and trace elements? The elements whose RDA is less than 100 milligram per day. 100 milligram per day. Those elements we call trace elements or minor elements. Right? Next. Now, remember this mnemonic. It will be helpful for you to remember the compounds formed from copper. Can you read out? CULT, cult, mask, MASC. Now each letter stands for something. C for ceruloplasmin, U for uricase. What is ceruloplasmin? If I ask anyone, last bench, who are not busy with biochemistry at all? What is ceruloplasmin? তুমি বলো, পারবি না? তুই পারবে? কে পারবে? Anyone? Fastest finger first. What is ceruloplasmin? See, the fallacy is ceruloplasmin is a copper containing iron transporting protein. I repeat, ceruloplasmin is copper containing iron transporting protein. That means it's a protein which transports iron, but it is made up of copper. So when this protein carries the iron from one side to another side, it also carries copper within it. Correct? So it's a copper containing. Now to synthesize and release ceruloplasmin, it is synthesized from liver. To synthesize and release ceruloplasmin from liver, we require a particular enzyme called ATPase7B. ATPase7B. This particular enzyme is very, very important for release of copper within a package of ceruloplasmin from liver to the plasma. So if there is a deficiency of copper in diet for prolonged period, then the liver will receive less amount of copper and it will produce less amount of ceruloplasmin. So it will carry less amount of iron. So it will lead to anemia. So the anemia will take place not due to deficiency of iron in the diet, but due to deficiency of copper. Correct? That's why ceruloplasmin is very, very important. It is also used as an acute phase protein. It is also used as an acute phase protein. Acute phase protein means the proteins whose concentration may increase or decrease in certain disease condition, like a marker, but it is not so specific. It is having a broad spectrum. So ceruloplasmin is measured, which increases in case of gross inflammation kind of condition. Okay, ceruloplasmin will increase. It has similar effect with ferritin. Anyway, uricase. It hydrolyzes uric acid. Lysyl oxidase. Can anyone tell me where did you find this enzyme? Anyone? You should be able to answer these questions, very easy questions. I wonder, I tell you, see, this is not how you should participate in MBBS classes. You must grow up, you must change your view, attitude. This is not done. This is not a mere high secondary class or a general degree college class. Please, open your eyes. Please. Things are going to be harder and harder in coming days. I guarantee you. I have a daughter almost of your age, so I know things are going to get harder and harder. It's very difficult. So please, gear up. Shake off your laziness and do something. Do something. Don't just sit idle. Keep your brain working. Okay, fine. Lysyl oxidase, we couldn't answer. Lysyl oxidase is an enzyme, important enzyme, found in the cross-linking of collagen. Two successive side by two কি বলে পাশাপাশি থাকে এটা পাশাপাশি collagen fiber, they make cross linkage between two collagen fibers, adjacent collagen fibers. Like this. There are in collagen there are 1/3 glycine, 1/3 hydroxylysine, and 1/3 hydroxyproline. So the hydroxylysine residues, they form this cross-linking between two adjacent collagen fiber. Correct? Hydroxyproline helps in the other way. It helps in the making sharp turn, because proline is not an amino acid, it is an amino acid. It has more kinkiness compared to other amino acids. So the sharp turn is due to presence of hydroxyproline. And glycine, when two collagen fibers or three collagen fibers come to near each other, they should be packed very closely. So glycine, having no side chain, provides that short space. Okay? So these three have functions. So lysyl, the prolyl oxidase, the enzyme responsible for synthesis of or conversion of proline to hydroxyproline, also contains copper. Lysyl oxidase contains copper. So in absence of copper, what will happen? What will be the effect? Poor wound healing. The cut, the scratches will take longer time to get healed. Huh? So this is thing. T, tyrosinase. Can anyone tell me tyrosinase enzyme? Where do you find? Correct? So if the tyrosinase is not there, then the sideway synthesis pathway which synthesizes melanin will not be there. What will happen? White hair. White hair is possible by only putting white dye. Although the hair is white, but most of the people say I don't know why. White hair, they call it grey hair. Yeah? What else? M, monoamine oxidase. All amino oxidase means amino acid to corresponding amino oxidase. MAO, monoamine oxidase, MAO. Where do you find MAO? Not in China, in biochemistry. In China, MAO is like 1 paisa. You know that? Yuan and Mao. Yuan means rupee, Mao means paisa. Anyway, MAO, MAO, monoamine oxidase. Where did you find? Anyone? In catabolic pathway of something. In catabolic pathway of catecholamines, epinephrine, norepinephrine, dopamine. The catabolic pathway of catecholamines contain MAO. What is the catabolic end product of catecholamines? Vanillyl mandelic acid. Vanillyl, double L, Mandelic double L acid. Why do you measure it? Why? What is the reason? Why do you need to measure this? Name the condition. Increase synthesis. Name the condition. Good, correct. Some toma. Very good. Pheochromocytoma means ectopic production of catecholamine. Sometimes have some kind of a type of cancer. Where epinephrine, norepinephrine are synthesized not in the adrenal gland but somewhere else in the body. Fine. Now, A stands for ascorbate oxidase. Now, absence of this enzyme increases vitamin C RDA. That means dehydroascorbate to ascorbate. This conversion requires ascorbate oxidase. This conversion doesn't take place. So, as vitamin C requirement in the body will increase. That means what? What you will suffer from? Oxidative stress, superoxide dismutase, and sulfidyl oxidase. Okay, superoxide dismutase, what is that? It is an antioxidant enzyme. Superoxide consuming enzyme. What is sulfidyl oxidase? What is its role? I told about collagen. Is there any other protein you know which is like collagen? Very long, fibrous protein. Bolo? This enzyme forms cross-linking with the alpha keratin. Next, cytochrome oxidase. Two next na. Cytochrome oxidase. Cytochrome oxidase means, where do you find cytochrome oxidase? Electron transport chain. Okay? Cytochrome C oxidase, cytochrome oxidase. They both, cytochrome oxidase itself contain copper 563, 565, 66, and this one is cytochrome C oxidase, means the enzyme which is responsible for conversion of or transfer of electron from cytochrome C. Right? So this is the importance of copper. Next. Now there are two disease conditions we have to study. One is copper excess, and there is copper deficiency. First we start with copper excess. Name of the disease is Wilson's disease. This is also called progressive hepatolenticular degenerative disease. Hepatolenticular degenerative disease means what? The hepatolenticular cells are degenerated. Name itself suggests. The liver is degenerated. What will happen? What the patient will present with? See the symptom. কি symptom দেওয়া আছে? দেওয়া নেই? আছে তো? দেখ। Yellowish discoloration of skin and sclera. That is jaundice. But this jaundice is not supported by neither alkaline phosphatase nor serology test. Means it is not viral hepatitis. It is not viral hepatitis, but there is abdominal pain. Correct? So then you must, and the age of the patient is less for children. So there you must suspect it might be Wilson's disease. But it should be given some other things also, like appearance of KF ring, Klager-Fechner ring. KF ring. This ring is like a greenish deposition of copper in the lens around the pupil, which you can see using an ophthalmoscope. Right? So pressure fusion ring, and it also presents with low ceruloplasmin in serum. Why? Because of the, see the enzyme defect? ATPase 7B. That means copper is there in the liver, but it is unable to be distributed through ceruloplasmin. So it gets accumulated and liver cell is destroyed. Accumulation, abnormal accumulation of copper in the liver. Next. Menkes disease, copper deficiency. Now ATPase 7B is required for discharge of copper from the liver. ATPase 7A is required for absorption of copper. In this case, both are missing. In this case, in severe case of Menkes disease, both are missing. So what will happen? Neither it will be absorbed, and if something is there also present in the liver, that will not be used. Right? So in that case, there will be copper deficiency throughout the body. So what will happen? Kinky hair. Why kinky hair? The proper cross-linking of keratin will not be formed. Why? Because of deficiency of copper. Which enzyme? Sulfide deoxidase. Very good. So that is the reason why kinky hair. Why graying? Because there is no melanin synthesis. Okay? Flagging will be there. Means some portion will be hypopigmented, some portion will be hyperpigmented. Like that. The most dangerous part is the brain damage. If it is not diagnosed early, brain damage is for sure. What to do? We have to infuse copper, because oral supplementation will not help. They cannot absorb. We have to infuse through injection, IV copper. And that we have to carry out at least till the age of 12. Till the brain is developed, at least. Okay? That's all. We'll stop here. Next. একটা পড়ে দিই এটা একটা ছোট্ট compound D-penicillamine. Sometimes it is asked, a short question. Role of D-penicillamine. D-penicillamine is a compound which is used for chelating mostly dications. Most preferred ion for D-penicillamine is copper. Next preferred ion is iron. Next, lead, right? Cobalt, all heavy metals. So in case of heavy metal poisoning, you can give D-penicillamine, not in case of arsenic, right? Why? Because it will chelate the excess of the heavy metal or copper in the body, and it will be excreted through urine. So body will get rid of excess of copper. It is also used in case of certain other diseases like arthritis. Helpful. Good. Next. Like this. Why? Because of the transfer of phosphate. Because the glucose is absorbed and which is trapped by adding phosphate. So the phosphate is reduced in the blood and increasing the inside the cell. They just change their compartment. Pseudo. Then what? Copper is very, very important. That cult mask, you remember, and each one with their effect. Each one with their effect.